Greetings, I'm Keith Klein, the host of the VentureFizz podcast, where I interview the most fascinating people in the tech scene. This is episode 387, and today's guest is John Voith, CEO and co-founder of InStride Health. A common theme for John that you'll hear throughout this interview is how he has always followed his head and heart. It's a philosophy where you can build something meaningful for the world that fulfills your interests, yet has a mission to help people. Healthcare is certainly an industry where one can have an impact, and what's interesting is that he has never wavered. As you'll learn, John's interest in healthcare began as a child, and it has followed him throughout his career and entrepreneurial journey. InStride Health provides specialty outpatient care for pediatric anxiety, obsessive-compulsive disorder, and related presentations. The company is venture-backed with $56 million in funding raised by General Catalyst, 406 Ventures, Valtruis, General Brigham Ventures, and Hopelab Foundation. In this episode of our podcast, we cover lots of great topics, like John's background story and how medical illness and his family influenced his future in the healthcare industry, seeing rapid growth of his career at Athena Health, where he became one of the 4 general managers in the company, the founding story of Valtruis, a venture-backed company that provides preventive dental care and care coordination through teledentistry services, on-site services, and virtual support, all the details about InStride Health and how he met his co-founders, Drs. Mona Potter and Catherine Boger, plus all the details on their unique and effective approach to treatment, lessons learned as a CEO, and advice for healthcare entrepreneurs, and so much more. Okay, quick side note. If you are listening to this podcast, then it is highly likely that you are interested in the founder journey and lessons learned around building companies. So please make sure you don't miss any future episodes by subscribing to the VentureFizz podcast on Apple, Spotify, YouTube, or SoundCloud. Oh, and please don't forget to leave us a review. It will really help us out. All right, without further ado, here's my interview with John. John, thanks so much for joining us.
Yeah, of course. Happy to be here.
Yeah, so we've got a lot to talk about. The company you're working on is very meaningful, and we're going to get into the weeds of that because it's something that is, it's a problem. And, anxiety, OCD is something that a lot of people struggle with. And what your company's working on is obviously helping people overcome that. So, but before we get into that, let's talk about your background story. So where'd you grow up? What were you like as a child?
Yeah, happy to do that. So as a child, I grew up mostly in Southern California and Miami, Florida. So warm weather environments. I was a big competitive swimmer. So in a pre-Olympic swimming program, which really was required a lot of discipline and focus and commitment. A lot of hours in the pool.
It seems so hard.
Yeah.
So you were actually working towards maybe being an Olympic athlete.
I think in Southern California, it's a really competitive sport, and I was relatively good and quickly got put into that type of program. And so I was in the pool 6 days a week. And as I got older, there were doubles. It was quite the commitment. And really it was a lot of dedication and focus. And that became the epicenter of my life. At the same time, I really like math and science, and also was a bit of a family kid, a lot of time with my immediate family. And some of that was related to my family story. There was some medical illness in my immediate family. And so, all of that was how my childhood played out, having heavy swimming focus, math and science, that family component. And as we get into the arc of my career and InStride Health, there was a moment in my life where all 3 of those things connected. So not just the swimming and the dedication and commitment required there, but also the math and science led to a real interest in business. And the piece of my family journey, a lot of intersection with that healthcare system. Ultimately, all 3 of those things came together. And for me, it just made sense to do business in healthcare and to try to make others' lives a little bit better when they were accessing the healthcare system. I had seen so much of it that it just made sense to do business in healthcare.
So I think you just connected the dots for something I was going to ask you, where I forget if it was another podcast or something that I read about you. You did gain an interest in healthcare very early on at a young age, right?
Exactly right. It was it really came back to my childhood and what I had seen. It wasn't all bad, but I just got a lot more exposure to the healthcare system, I think, at an early age than a lot of people do. And in those reflective moments, it really means a lot to me to try to make the healthcare system a little bit better for others who are going through whatever they might be going through.
Well, it's impressive that you were able to figure that out, and then you did carve a career on this journey because
That's
you went
right.
on to study at Harvard in the sciences.
That's right. Yeah, I think it was around college time that I connected the dots and made sense and had this whole meeting make sense to me in this way. And so whether it was my academic side, so both at Harvard, then back in grad school at Wharton and Harvard Kennedy School, the whole time I was connecting business and healthcare through that, and then my career as well through every aspect. That was the central why was combining that head and the heart and doing business and healthcare and trying to make things a little bit better. I was at Athena Health, and we can go into each of these, but Athena Health for about 7 years as a strategy consultant before Athena Health. And then started two companies that were at that intersection as well of business and healthcare.
Well, so your academic pursuits, so you went from Harvard, then you went on to get a graduate degree from the Harvard Kennedy School, right? And then you went to Wharton for your MBA.
That's right. The
Okay,
Wharton Harvard Kennedy experience was a combined grad school experience. So there was a little
got it.
bit of flying back and forth from Philly to Boston during that time. But yeah,
Wow.
yeah.
Okay, so you did start out as a strategy consultant in healthcare. So what did you work on?
So when I first started as a strategy consultant, it was mostly projects for big pharmaceutical companies that were focused on drugs that those companies were launching. So while my career ultimately didn't lead down the pharmaceutical bent, that role as a consultant just provided massive exposure to the healthcare system, to insurance companies, to physicians, to patients, and really helped me understand the various incentives in the healthcare system that then later informed and helped me navigate in the roles that I've been in the more recent years.
So when you joined Athena Health, like what brought you there and what did you initially work on? Because you were there for a good stretch, like maybe 6, 7 years. So what did you come in starting out at, and then eventually, what did your career look like?
Yeah, so when I joined Athena, and I would say each chapter of my career, I've looked at opportunities that were out there and really tried to find the one that most connected the head and the heart. And at the time, Athena Health, I found the company. They were solving a massive problem in society and in healthcare, where they were really taking a lot of the waste out of the physician practices to allow physicians to focus on patient care. And so when I joined, I started as an individual contributor working on a variety of operational projects. And then over the course of about 7 years, just got moved into whatever problem du jour the company needed to solve, and went from an individual contributor to someone managing operational teams to a product leader, ultimately to a general manager of the company, and was I left Athena Health as one of the 4 general managers. I led the interoperability units there.
So what does that mean?
So within Athena Health, we had expanded from the time I started. We were just focused on what was called practice management. We also had an electronic health record. We also had a patient doctor communication portal, and interoperability was all of those systems' ability to interact with each other as well as to other systems in the ecosystem. So if the electronic health record needed to send a lab and receive a result, we built electronic connectivity to allow that information to flow. If the electronic health record, a patient chart, needed to move from a primary care doctor to an emergency room in a hospital, we built the electronic connectivity to allow that record to move. So it was all aspects of electronic information moving between Athena Health systems and other systems in the ecosystem.
So Jonathan Bush was a guest on my podcast for episode 250.
Oh, wow.
And we obviously talked about the whole story of Athena Health and what he's working on now with Seuss. So what was it like working with him?
He was just an incredible visionary. I think what was inspiring about him is he uh, really led with his heart, and the same way that I felt like I connected to the healthcare system at a young age, he really exuded that, and you could tell in every communication that he really wanted to make change in the system and make things better. And I think that a whole generation of us, joined the company to follow that and jump on board. And what was amazing about the group that was there at the time was there were a lot of really smart people in a bunch of different domains as well. So we all joined for different reasons and we all joined for slightly different reasons and had different skill sets, but we were all there to follow his big visionary push, and he got us all really excited to solve some big problems. And I think that was one of the best things that I learned from him at the time. I learned other things as well from him, but that was it was really a great time to be there with him at the helm for that reason.
And I forget, when did Athena Health go public initially?
So it was just before I joined. I joined in about 2010 as an MBA intern. I believe it was 2009-ish. I need to check the exact date, but it was just before I joined, because when I joined, there was some executive change related to being a public company, and we were really starting along the public company journey right before I joined. We were probably about 80 million when I first joined, and when I left, we were about $1 billion in revenue. So
Wow.
we grew quite a bit in those 7 years.
And that was my hunch, and that was kind of why I was leading down the path, because during
Yeah.
those 7 years, you saw aggressive growth, and you were one of the GMs in the company ultimately. So, what do you think were the factors that led to your success, upon your career, you know, climbing the ladder to a GM role? Like, what were the attributes that got you there?
I think it was really a complete focus on solving the problem that the company needed solved at the time. There were so many problems to solve, and I think what Athena really got right in its culture was that it elevated and rewarded people who were solving business problems. And so even as we were growing quite a bit, there wasn't as much of a political big company type of atmosphere there. It was really about, if you're solving problems with a company, you knew you were going to succeed in your career in some way, shape, or form. Whether it was the department you were leading getting bigger because you were solving that problem and helping the company grow, and therefore you'd be doing well in your career, or the company oftentimes would reorganize people around the company to solve the next problem. So for me, it was just a relentless focus on that, doing the right thing, solving the problem, and then the rest took care of itself from there.
All right, so what did you do next?
So at the end of the Athena experience, I went to Athena, and I was really inspired, not just by Jonathan Bush, who you mentioned, but the whole executive team there were these entrepreneurial people, some of them who had started multiple companies before, and I had the opportunity to learn from each of them during my experience there. And I think towards the end, I realized that I had just had my first child with my wife. We had our first child, and even back in business school, I had thought about starting a company, and I just felt like, look, at this moment in my life, this was my opportunity to start a company and potentially start a company, and so I was quite interested in the idea of starting a company at that time, and I happened to meet through that exploratory journey a dentist who also was in the same kind of mindset. And I don't know that I ever expected to go into dentistry after Athena Health, but I met this dentist, and through conversations with him, gained two different insights that then led me to co-found a company and grow that with him. The first was that I realized, wow, oral health is so siloed, and it wasn't connected to the rest of the medical healthcare complex. And that was just like a big aha for me. And I reflected on my time at Athena, and we were serving all these different specialties. We never really got close to dental. We barely touched dental. And I think through getting to know the dental space, I just realized how siloed it was, and started to question, why is it so siloed, especially when there's clinical benefit from it not being siloed. And then the second thing I realized was that within dental, I was fascinated by the fact that within dental, there was such a focus on treating and not prevention. And so, like, one of the most interesting statistics that I figured out and saw early was that of people with commercial insurance, commercial dental insurance, only 50% of them approximately use the preventive benefit. So the whole dental,
Wow.
the whole dental ecosystem is just so focused on drilling and crowns and root canals, and there's just such a myopic focus on non-preventive things, and so I got really interested in that, and that's really what led me to co-found a company with this dentist, which we call and the company we called Virtudent. And so that's what I did next, venture-backed company, and we grew and scaled that for the next few years all over the country, and it was really a rewarding experience.
So the model, and please fill me in if I'm wrong here, was preventative dental care for workplaces. So you would actually come on site.
That's exactly right. In order to solve the problem that we saw in the dentistry ecosystem, we did exactly that. We brought on-site dental services to Fortune 1000 corporations and made it extremely easy to get preventive oral health care. And so the whole idea was like, all these people are not getting preventive oral health care. The dental industry is so siloed. It's so focused on treatment. Let's just make it so easy and simple to get preventive oral health care that more and more people would do it. And we did that. The good news is we got HR departments to buy into that vision and to see the benefit of investing in preventive oral health care. They let us on site and made it super simple for their employees to get high quality oral health care.
So people would be like, "Wait, I got my cleaning. I got to step out of this meeting."
It was wild. We put the dental office 6 steps from their desk, and it was amazing how many people signed up and started to get preventive cleanings. And it became not just a healthcare thing that helped on the medical side, which it did. We found these interesting connections between oral healthcare and medical, but also it became a perk for some of these companies. So the companies would bring in dental, and they would then advertise when they were trying to recruit employees. They would say things like, "And we even bring the dentist to the office." That's it became this early for these companies, which is really cool to see. And and it was it was a real eye-opening thing of, if you can make something just a better experience and more convenient for people, it does help them do the right thing.
And I guess, and the benefit for the company is, hey, they're going to get preventive care that's going to, help our premiums of dental insurance hopefully go down because there'll be less issues. And then as you connected the dots, there's healthcare beyond your teeth that affects the whole system that is also hopefully bringing down their health insurance.
100%. Yeah, our hygienists and dentists would, I mean, this is one example, but they'd find, but for people who hadn't been going to the dentist in multiple years, or we'd have a lot of people that hadn't gone for 10 years to get a preventive oral cleaning, even though they had appropriate insurance, but they would find things like oral lesions or precancerous lesions that then would help that, when identified, they could help that patient get on top of that so it wouldn't progress further. And there are all kind of interesting connectivities between the oral healthcare uptick that we were helping and also reducing medical costs for the companies as well.
And did you go through Mass Challenge?
So that company started out in Mass Challenge. My co-founder, the dentist I referenced, got his start, he was working there when I met him, and then we incubated the company at Mass Challenge before we left and got our own office.
Got it. Okay. And then you did raise, I think it was 10 million from what I saw from 406 Ventures, Spring Rock Ventures, and Sparta Group.
That's exactly right. Yep. We venture back. We scaled the company. We started in the local Boston ecosystem, and then began to sell into companies in many states around the country from there. But the Boston ecosystem was there are many companies that have their headquarters in Boston, and so our sale was primarily to the HR department. And the fact that the headquarters and HR was in Boston did help us get an accelerated start.
And so what were the challenges? Like when I think of building a company like this, it's, scale, right? You need dentists or you need hygienists, I guess. Like how do you scale this type of operation? Seems like there's a lot of logistics and the human capital.
Yeah, so there was definitely a heavy logistical piece of this company that was about having the right equipment in the right geography and having staff in the right geography that could serve the company appropriately. We did solve some of those logistical challenges, though, because part of our model was while we brought the dentist to the office and the preventive oral health care to the office, on site, the dental hygienist was on site with the appropriate equipment. We had the dentist virtually most of the time, and the dentist was performing teledentistry virtually. So that allowed us to at least solve some of the logistical components and made it a little bit easier to scale. With that said, no doubt, a big part of that company build was the logistics of it and matching the right workforce and the right equipment to the right space. and that is a big part. But no doubt the teledentistry piece helped a lot. I learned through that experience some of the limitations of telehealth. No doubt in dentistry, you can have dentists doing certain things like looking over an exam, where the hygienist is powering that information, but you can only go so far, as you can imagine, and with telehealth and dentistry. And it was a real eye-opening, lesson learned, lesson-filled experience around telehealth as well. And I think at the time, if you could rewind the tape with telehealth, um, I think it was sort of, there were a lot of people that were thinking, how far could this go? And where, could telehealth be everything? And especially as you got into COVID, every specialty was trying telemedicine. And I think I gained a real appreciation, though, through my experience of there's going to be some places where telehealth is going to make sense. And there's going to be some places where it probably won't make sense. And so going into COVID, that I carried that lesson with me.
And that's right around the time you moved into the CEO role, right?
That's right. Exactly
yeah.
right. Exactly right. Yeah. Both at VirtueDent and then ultimately at the next company as well, at InStride Health.
Yeah. Okay. So what was the outcome for VirtueDent?
So ultimately, VirtueDent, if you think about our client base, we were serving employees on site. We had scaled the company around the country. When COVID hit, all the employees went home, and so the
Right.
business, we really scaled it way back and put it on, I would say, a little bit just on ice is the best way I can describe it, waiting for a moment to relaunch it. I think the investors and I were interested in relaunch or pivots. We tried a few pivots. Ultimately, we thought that what made the most sense was to relaunch at the appropriate time, when employees returned to work.
Mm-hmm. Yeah, makes sense. All right, let's talk about what you're up to now with InStride Health. So what is InStride Health?
So InStride Health, we provide clinical services specifically for kids, teens, and young adults, so age 7 to 22. And we specialize in anxiety and OCD care for that population.
And so you're the CEO and a co-founder, but you mentioned you had met, you have other co-founders. So if you could talk about the history, the background story of the company.
Yeah, no. So I'd say you heard a little bit about my background already and what led me to InStride. My co-founders, my two clinical co-founders, they had spent nearly 2 decades at McLean Hospital. So McLean Hospital is a Harvard teaching hospital, #1 psychiatric hospital in the country. And they were both individual contributor clinicians there for 10 years, and then built programs there for 10 years as well. And they led the child and teen programming at McLean. And so when I met them, it was the middle of COVID, and a lot of their programming, if not all, had gone virtual. And what was really interesting as we got to talking is, as we looked at the various programs that they were leading at McLean, there was at least one program, which was called the McLean Anxiety Mastery Program, that was performing as well or better than it had virtually than when it was in person. And so as we dug into that, getting back to this idea of what performs well via telemedicine, what does not, it was fascinating that this program was performing so well. And we started asking ourselves, well, if this can perform so well virtually during COVID from a clinical outcomes perspective, why not expand access beyond just patients who can get care at McLean Hospital? And Kat, Mona, and I really aligned around that mission and vision, and that ultimately was the foundation for what became InStride Health. I can tell you more about how that came to be, but that really was the foundation of the company through Mona and Kat's work and what they had accomplished at McLean, and then that idea to make their programming more accessible.
So at what point were you like, okay, this is something that I want to sink my teeth into, and this will be the next company I help build?
I think it's back to at each inflection point in my career, just reflecting on that head and heart dynamic. And I think with Mona and Kat's work, I got to know some of the families and patient success stories that they had achieved at MAMP, and there was such a positive trajectory in the patient's lives and the whole family's lives around the patient that really connected to the heart for me, back to my story and where I started. And then from the head perspective, I just saw that this really could be a great business opportunity. I think I mentioned some of the lessons learned at at Virtudent around telehealth, and in knowing that this program, MAMP specifically, was performing so well from a clinical outcomes perspective virtually, it really resonated to me that this could be a scalable business that could work as well and could continue to produce clinical outcomes as we scaled it. And that really made a lot of sense to me from a business perspective as well. So for me, it was just the head and the heart connecting, getting to know Mona and Kat. And if you have them on your podcast someday, I think they exude that heart as well. They exude the heart, and it just made sense to me getting to know them and their clinical program.
Yeah, and they're obviously, deeper into the research and the medical side of things, but just based on me being part of society, it seems like it's a growing and unfortunate trend of anxiety and OCD for kids, and having this you know hopefully solution for pediatric help is obviously needed because it's just a growing issue, right?
100%. I mean, this is a big issue prior to COVID. COVID really shone the spotlight on the issue, and the issue continues to progress and get worse. And I think with Mona Cat and the company we're building, we just hope to be part of the solution to make things better for the kids and their families that are going through this.
Now this is your last company, it was on-site care. This is an actual platform. There's this tech, and your founding CTO is has an amazing background as well.
Exactly. Yeah, no, exactly right. We still are a clinical service. We see ourselves as a clinical service company. With that said, to your point, underneath is a big product and tech foundation that enables that clinical quality at scale. We've done a lot. We've done a lot to invest in technology to make sure that we can continue to ensure the outcomes are there over time as we get bigger and bigger and bigger, and to make sure things are working efficiently. Because ultimately, the biggest difference between what exists in the market and then what we're doing at InStride is delivering this care efficiently so that it can be in network with insurance companies. Traditionally, the kind of care that our care team provides, you can find it in small pockets around the country in the United States, but typically you find it for parents are paying self-pay for that kind of comprehensive care, and they're going to pay 10, 20,000 a month out of pocket for this kind of comprehensive care. So by using technology to really lock in clinical outcomes, but also make things much more efficient, we're able to get in network with insurance companies at rates that are much less than what you would be paid in a self-pay market, and have it still work financially for the company to grow and sustain the kind of quality that we'd like to sustain. So
Yeah, because what I didn't realize when I was just reviewing more about your company and website, there's a whole treatment team that is helping the patient. So there's the therapist that's like the team lead. There's the exposure coach that's like the motivation and practice side, and then a psychiatrist to focus on the medical medication side of things.
exactly right. So ultimately, the treatment is grounded in CBT, which is a gold standard evidence-based care. But to your point, what really differentiates the programming is this dedicated multidisciplinary care team that has both a pediatric psychiatrist, a pediatric therapist, and then also an exposure coach. And the reason for this care team is that um, we can do a few things. One is that we really embed not just with the patient, but with the parents, with the school, with the pediatrician. And also having this multidisciplinary care team allows us to bring care to life even outside of that once a week typical therapy appointment. Our exposure coaches are with the patient 24/7, really helping to um, execute against the care plan that the therapist puts in place. And then the psychiatrist is involved medically if needed with meds, and also for medical complexities that come up. A lot of our patients have a lot going on in their life, a lot of comorbidities. And so just by having that whole group surround sound with the patient and the family, it really helps to stabilize, get things on track, and put the skills in place that really lead to lasting change for the kid and family.
Yeah, it would seem that the platform that you've been building, how it's tech enabled, that's the right type of platform. That being like more telemedicine for this use case is the right form of delivery.
100%. Yeah, the with anxiety and OCD, you tend to get a lot of avoidance. That just tends to come with the territory, and when you can really bring care in real time into everyday life by surrounding and bringing the multidisciplinary care team into life with the family on an everyday basis, rather than sort of taking the kid out of their everyday life into a medical complex, it really helps to deliver the right care for the family and the patient.
All right. So what does the outcomes look like? Like you publish an outcomes report. So what has been the latest findings there?
Well, so I'd say two things on this. We have all kind of great statistics. One of them is, that speaks to me, is that 98% of patients get better by the end of our program. Yeah, we have
Wow.
we have a time-bound program deliberately, and the whole idea of our program is to build skills that even once the patient and family graduate, now the patient and family have, so they can keep that lasting change going, and the kid is no longer a patient. The kid is back into their life using the skills to help them succeed. So love that stats like 98% of the kids are improving and getting better. With that said, I think for me, what's even more important is I get to speak to a lot of the families, whether it's during or after care, about their experience. And even just walking around town, sometimes I wear my company. We have some swag. I wear InStride Health fleece, and a parent will grab me, or whether it's one of these follow-up calls from how the program went, the parent will say something like, "This program totally changed the trajectory of my kid's life and my life." And you can see, I can see, when I get to talk to them in person, or even by a Zoom like this, just how meaningful it's been for them, and how meaningful it will be for the years to come. And that I think is, in addition to the stats we put on that related to the outcomes we track, I think that's really what gets me fired up and keeps me inspired and motivated as we build the company.
And what was it like? So you've raised capital for this company as well. So you did a Series A of 26 million in 22, and then you announced your B round of 30 million from 24, led by General Catalyst. So what was the process like for raising capital? Because this, it is more of a tech platform, but it's also, you need, the right teams of human capital to deliver this service.
Yeah. I mean, we've been really fortunate with our investors to date. I think early on, what I didn't get to mention earlier is one of the ways that I met Mona and Kat was through one of the investors of Virtudent. So my last company, one of the investors in that company helped facilitate a bunch of contacts for me when I was exploring what might be next for me. And so that just by the fact that seed investor was, which was 406 Ventures, was in the last company and had introduced us, it was such an obvious natural fit for them to lead our seed, that was just a really, really nice connectivity point. And then MGB Ventures, which is part of the health system that operates McLean, they also were part of our seed as well. So there was just such an obvious great foundation from a financing perspective, with investors that really understood healthcare and health services. And then that trend has really continued throughout. So investors that followed were similarly steeped in health services and health tech. And so raised from Valtruis, our Series A, and then General Catalyst from our Series B. And it's really been, I guess to your comment, nice to have capital partners who really understand the space we're in, and in some ways, folks who understand it have led to others that have understood it, and that's made my life easier in some ways. And it's also not only in raising the money, but also operating the company. I have really, really great partners on the board that understand the space we're in.
And who is the partner at 406?
It's Liam Donahue.
Yeah, that's what I figured. But yeah,
Yeah.
The team at 406, when they invest in a company, they're very deep, and it's almost like, they incubate some of their own companies. It's, they're, you don't feel like they're just taking a chance. Like there's a lot that goes behind their investment decisions, and the feedback I've gotten from other entrepreneurs about how they follow that portfolio company through each phase is just a great partnership.
100%. Yeah, and I'd say 406 has been fantastic. My other investors have also been fantastic as well, and I
Sure.
feel quite fortunate.
All right. So what's the state with the company and looking ahead?
So yeah, we've grown from we in our early days, the McLean story with Mona and Kat, partnered with McLean to get some of the initial MAMP team out of McLean to start an fully independent company called InStride Health, and that naturally led us to starting in the Massachusetts area with our growth trajectory. Um, we've since then expanded to 10 states, added a number of insurance partners and carriers in those states where we can accept commercial insurance in those 10 states. And so for us, there is still a lot of opportunity to continue to expand states and add additional commercial insurance partners in those states and other states we expand into, and that will be the next number of years. I mean, anxiety and OCD are such a uh, there's such a massive need in the markets we're in, and there's so many parents that are reaching out. And we're covered by most commercial insurance companies in the states we're in, but there's so many other parents that are reaching out in other states, asking for us to come and help given the need. There are physicians in those states that, whether it's pediatricians or other mental health providers that tell us about the need in those states and the massive need that they have, and they really need our help. And there's other payer partners that are reaching out. So we're going to focus on continuing to bring the care model we have to these new geographies and to these new commercial insurance companies, given just the need we know is there in the market.
Yeah. And what does each state require? Like, do you need to be licensed, or what are the state requirements?
For us, it's super important to have this kind of care be covered by commercial insurance carriers. And so for us, it really starts there. We've been fortunate in the same way with our initial commercial insurance partners that helped us get in network in the kind of way that we needed to make this model work. And as we continue to grow, the same thing. So it really starts there. Making sure that this kind of care can be commercially covered. And then from there, of course, a strong care team that's licensed in the state, such that we can provide the care. And then finally, we really embed ourselves deeply in each community we're in. So getting to know referring providers that are on the ground that have been practicing medicine in that community, other mental health providers, pediatricians, hospitals. There's massive need in the market, but really helping to be a member of that community and facilitate educational resources to embed ourselves in the community as well is important. So all of that is involved in launching new markets for us.
So looking kind of back at, your previous company and current as CEO, what have been the biggest lessons learned?
There are so many lessons learned. I feel like the one that comes to mind right now is just the humility to know there's always more to learn. So of course, there's all these technical lessons that I could I could espouse, different things people have said. But I think the biggest one is just the humility to constantly be willing to learn. And the world around us is changing quickly with AI, and there's constantly new things in each local market that we're navigating and considering. And at each stage of the company build, lessons are different. I think we talked about my experience at Athena, going from 80 million in revenue to $1 billion. There are a bunch of lessons learned there. Go at VirtueNet, going from 0 to 10, or tons of lessons learned there. And I just think at each stage there's different lessons. So constantly being situationally aware and willing to learn about what's needed at that stage for that company is the biggest thing.
And I guess, as an extension, kind of like what you were just talking about, like if I was a first time founder, eager to get started in healthcare, because there's so many opportunities, especially with the platform shift to AI, like what foundational advice would you have for a health tech entrepreneur?
I think in health tech, like go back to where you started with me and my background. I think there is such a discipline, focus, commitment required to build a company in this space, because you have all the tech aspects that you typically have, but you also have all the regulated aspects of healthcare and all the big entrenched interests in healthcare that you need to navigate as well. That building these companies are really, really hard. So making sure there's a mission big enough that you care enough about that you can have that kind of commitment and focus and endurance on I'd say the biggest thing first and foremost. Beyond that, there's all kind of other lessons learned, but I think that is the biggest one. The biggest one to start, is this mission big enough? Do I care about it enough to commit enough time, attention, focus to make it work, given how hard it can be to build in healthcare?
Yeah, I mean, and the entrepreneurs that I interview for this podcast, you can tell the ones that have been the most successful are the ones that are deeply rooted and care about solving the problem. It wasn't just a brainstorming event that stumbled across an idea, let's try to build a company around this type of thing. It's like their history or something that they saw that they were working on separately that ended up being a company. So, yeah, you need to be passionate because it's a marathon, not a sprint. So, uh,
100%.
what about raising capital? So you've raised capital multiple times. Like, what about, advice on, raising capital from, tier A investors like you have?
I mean, I think raising capital follows a similar lesson set that I just articulated, because I think that the investors know how hard it can be to build in healthcare as well. And the best investors in this space have invested in health services, tech-enabled services before. And so I think they're looking for the same things that you just said. And I were just like a founding team that really gets the problem, that's committed, that can endure. I also would say that this is just personal lesson that I don't know, learned or figured out, is that I don't know that necessarily all companies are appropriate for venture capital. And so I think a
A
lot
lot of
of
them aren't.
yeah, I think there's a lot of
Most aren't.
yeah, I think there's a lot of great companies that can and should be built that don't necessarily need venture capital. So I'd say, think about whether or not the business has the kind of need in it to scale quickly and with quality using venture capital dollars. If it doesn't need to scale as quickly, or there isn't as much of a need, perhaps venture dollars aren't really appropriate. And so it's really situational as well. I think this business, there is such a massive need. We see it in the market that in order to scale with quality and do the things, the tech enable that we wanted to do, it did make sense to be venture backed. But yeah, I've recommended to so many people that maybe that's not necessarily the right path, given the need in the market that they're focused on solving.
Now, what about hiring? That can be, a tricky thing. It's all about the team in terms of its ability to execute. What advice would you have on hiring, especially in the early stages of a company?
Yeah, I mean, I've learned so much about this. I wish I had. I wish I. There's always more to learn as well. For me, it's really a lot of the themes we've echoed is making sure there's that mission alignment. I guess second thing is really values alignment with initial team and co-founders. The culture of these companies is so important, and being aligned on that culture is so important, that no matter who the executives are and what skills they have, or whether it's a co-founder or initial executive, to get the culture right, having value alignment is super important. And with Mona, Kat, and our technical co-founder Jamie, that was something we spent a lot of time on in the middle of COVID in someone's backyard with masks on, talking about what cultural values do we share, and what would a company be like if we worked on it together. And I just think that piece is really, really critical. Yeah, I think those two things, and then of course just the skill set fit. I always recommend with early hires, especially the core team, over hiring, if you will, if you can afford it, hiring people that have experience in certain domains to make sure that you can accelerate through challenges that others might spend years trying to solve. A lot of these problems, well, no company that's being formed that is likely just a complete copycat of the past. There are many, many lessons learned in companies that have been there before. And so trying to find people that have that experience and bringing them in is really, really important and critical.
All right, 3 apps you can't live without. Can't be Slack, email, or your calendar.
That's a good one. So right now I've substituted my internet browsers on my phone with ChatGPT. So now on that bottom bar, my first go-to is ChatGPT. That's, speaking of the moment, just using it as much as I can, really changing the way I think around that. So I'd say that's number one of the moment. Number two is might be surprising, but for me it's Instagram, and mostly it's because that's how my wife will often send me content on Instagram, whether it's about kids or whatever it may be. It's just a fun way where we
Yeah.
communicate about things we see in life, everyday life. Trying to think what is a third one. A third one might be a cop out, but I look at the on I have an iPhone. I look at the stock app a lot, and not
Mhm.
because I'm a big trader of any kind. I don't follow anyone's stock, but I look at the macro themes, and I see
Mhm.
such a psychological connection between what's happening on that app and what I run into to people out there in the market, that for me, just having a general pulse on how things are moving helps inform how I think conversations are going to go in that week or that day or that month. So I'd say those are the three that I tend to use a lot. And maybe if I'll add a fourth, it's the podcast apps, because I'm loving podcasts. I'm probably newer to podcasts in the last, I don't know, 6 months, but I'm really loving podcasts. And it's been a great way to um, energize and stay educated on things, while I walk or work out or whatever it may be. So I added four. Sorry, not three.
Well, you segued into my next question, which was either book or podcast suggestions. So what podcasts are you a fan of?
So I'm pretty much every day I'm going to listen to the New York Times The Daily podcast. That's a pretty popular one, but it's just a great, quick way to deep dive into a story that is broader than the work I tend to focus on every day. So I like that one. I also really like the All In podcast. I really like staying um, plugged into the tech world. I'm running a healthcare services business, but tech is a big part of what we do. And so I really want to stay close to how they're thinking about things and what they're talking about. Those are the two I'd say that are my staples. Beyond that, I'm listening to all kind of fun podcasts, and I just find so many really smart people that are emerging in this space, and new brand names forming of people leading them. I like this one, and I am just blown away by the kind of uh, people that are on these podcasts, and how much you can learn in a long form session versus maybe sound bites or snippets that you previously would get on, I don't know, social media or something like that. So I really am enjoying the podcast trend, and I could probably list 20 of them, but right now I'm dabbling in all kind of stuff.
Yeah, All In's fantastic, and actually, I'm surprised it doesn't come up more often, because they get such a massive amount of listeners, and
Yeah.
Jason Calacanis. I was an OG now, so like he was the publisher of Silicon Alley Reporter back when I was just starting my career in the tech industry. So it was just New York and talking
Oh
about, it was
wow,
like a mini Tech Crunch and a print edition that I think actually was mailed to me.
interesting.
So
Nice.
anyways, I've been following his career. It's pretty crazy what he's been doing. So, all right, how about outside of work? What do you like to do?
I am the kind of person that I, because of the passion I have for the space I'm in, I'm always thinking about, I'm always thinking about, yeah, my company, and that's kind of like always on my mind. So what I like to do outside of work is to try to disconnect from that for moments. And for me, it's simple things like spending time with my wife and kids, just with no agenda. So we're fortunate that in our neighborhood there's just streets with not a lot of cars on them. So we'll just oftentimes go outside and hang with neighbors in the street, really no agenda. And I just love getting that quality time with wife and kids and friends, and just no agenda, just kind of try to live in the moment as much as I can. That's my favorite thing. I have other little hobbies here. I'm trying to learn how to golf. I'm not that successful right now, but I'm trying to learn to golf, and there's all kind of little things I'm doing. But I think my favorite outside of work is just trying to enjoy the moment as much as I can with the family.
That's great. Well, John, thanks so much for taking the time to walk us through your professional journey, obviously, all the great work that you and your team are up to now, and all the great advice.
Yeah, no, really appreciate you having me today. It's a fun conversation, and we'll talk soon.